Hello! Edutainment Studios and Access Healthcare welcome you to Birth Control Your Options. This module is part 1 of a 4-part series on birth control. Birth control, also known as contraception, is designed to prevent pregnancy. Birth control methods may work in a number of different ways, from preventing sperm from getting to the eggs, to keeping women's ovaries from releasing eggs that could be fertilized, and to sterilization, which permanently prevents a woman from getting pregnant, or a man from being able to get a woman pregnant. Your choice of birth control should depend on several factors. These include your health, frequency of sexual activity, number of sexual partners, and desire to have children in the future. Your healthcare provider can help you select the best form of birth control for you. In this course, the objective is to help you know the basic information about birth control so that you can make educated decisions for yourself and your family. Each month, your body prepares for a possible pregnancy through your menstrual cycle. An average menstrual cycle lasts 28 days, but yours could be longer or shorter. In the beginning of your cycle, levels of the hormone estrogen rise. This causes the lining of your uterus to get thick. At about the middle of your cycle, around 14 days, an egg leaves your ovary and travels toward your uterus. This is called ovulation. If an egg is released from your ovary and is not fertilized, it will dissolve or break down. Your hormone levels will decrease. Your uterus will get rid of the thickened, bloody lining through your vagina. This is your period. The day you start your period is day 1 of your menstrual cycle. After ovulation, during unprotected sex, your partner's sperm enters your vagina and moves through your cervix and uterus to the fallopian tubes. The sperm enters the egg to fertilize it and creates an embryo. The embryo travels through the fallopian tube to your uterus, where it implants or attaches to the walls of your uterus. Birth control stops you from getting pregnant. Depending on the type you choose, it will prevent your ovaries from releasing eggs. Or it will prevent sperm from reaching and fertilizing an egg. Or it will prevent an egg from attaching to the lining of your uterus. Most often, women use birth control because they want a reliable way to prevent pregnancy before they are ready to have a baby. But women decide to use it for other reasons as well. Depending on the type you choose, birth control can decrease your risk of cancer in your uterus and ovaries. It can also decrease your risk of pelvic inflammatory disease, or PID, ovarian cysts, and anemia. Some birth control helps to control acne, and others can reduce unwanted hair growth. Birth control can make your period more manageable by shortening it, reducing how much you bleed, and by making your cycle more regular. It can help reduce menstrual cramps and headaches, including migraines. And it can improve bleeding and hot flash symptoms of premenopause. This is the time before menopause when your hormones start to change. Before you start birth control for the first time, or switch to a new type, there are some questions your doctor needs you to answer. Do you want a short-term method, something you use every time you have sex, take every day, or switch out a few times a month? Do you want a long-term method, something you can switch out every few years or once a decade? Do you ever want to have children? How soon? Are you good at remembering to take medicine every day? Do you smoke? Think about what you want out of birth control. To prevent pregnancy for many years? To prevent pregnancy in the near future or until you are ready to have children? Talk to your doctor so that you can find the best kind for your body and lifestyle. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Here are some other sites for more information. Do your research. Knowledge is power and freedom. Thank you for joining us today for part 1 of this 4-part series on birth control, and come back for part 2.